Good morning and welcome to the first IPMG Professional Development Workshop in the 2018 series. I am Lana Hunt, Director of Training and Outreach with IPMG. Before we get started, I would like to provide a few reminders for those of you that are just joining us. Everyone that is attending the workshop today and everyone that registered for the workshop will be receiving an email within 2 business days that includes a link to today's recording as well as the materials that Diane shares. Also, this information will be available on IPMG's website within 2 business days. In addition to that, all attendees of today's workshop will receive an attendance email that can be used for certifying attendance if you are going to be using that for training credit. We will have time for question and answers at the end of Diane's presentation, so please type in your questions in the question section of your GoToWebinar menu that should be on the right-hand side of your screen. And finally, we do truly appreciate all of the feedback that we receive about our workshops, and a survey will launch immediately after the end of this presentation. So we would ask you to take just a few minutes to complete that survey so that we can use that information to help plan for future workshops. The next IPMG Professional Development Workshop will be held on Friday, February 16th at 11:30 a.m. Eastern and 10:30 a.m. Central, and registration for that workshop should be available shortly. At this time, it is my pleasure to introduce Diane Buff, IPMG's Medicaid and Intake Support Manager. Diane has been with IPMG for 10 years and has focused her attention on Medicaid eligibility issues for those receiving waiver services for the past 5 years. Today, Diane will be sharing information on Medicaid and tools to maintain eligibility, which will provide information to assist attendees with a basic understanding of Medicaid as it relates to individuals receiving Medicaid waiver services, identify and monitor annual Medicaid redetermination, reestablish Medicaid following a lapse, and provide information on helpful resources and how to utilize those resources. We are very fortunate to have Diane's expertise, and at this time, I will turn the presentation over to her. Thank you.
Thanks, Lana, and thanks everyone for joining me today. The goal is really to provide some information about those basic components of Medicaid eligibility. It's tailored for individuals receiving services through one of the developmental disability or med model waivers. It's meant to provide general information about some of those most common concepts that we face related to Medicaid eligibility for people on the waiver. This training is not able to get into extenuating circumstances or very specific policies. I will address how to apply for Medicaid, how to maintain Medicaid eligibility through the annual renewal process, and how to reestablish Medicaid following a loss. And there are also some resources that I'd like to share. I'm going to start off with reviewing some of the terms that I'll be using during the presentation. These include Medicaid, Medicaid waiver, Division of Family Resources, Medicaid aid category, traditional Medicaid, and authorized rep. It's essential to the rest of the training that you have a really good understanding of these concepts. Medicaid is a public health insurance program. It's a comprehensive health insurance that covers hospitalization, doctor's appointments, vision, dental, therapies, pharmacy, as well as some of those things that may not typically be covered by a private insurance policy, such as transportation to medical appointments and incontinence supplies. It's open to people of all ages whose income and resources meet specific guidelines. Medicaid is jointly funded by the state and federal government. The federal government outlines the components that need to be included, but then the state has the ability to set guidelines within that framework. So the eligibility standards as well as actual coverage varies from state to state. Medicaid eligibility for a waiver participant is vital because a person needs to have active Medicaid in order to use waiver services. I often hear that Medicaid could not possibly have lapsed because the person has the waiver. That's tied to some myth out there or general misunderstanding. Eligibility for Medicaid is established separately from eligibility for the waiver. Unfortunately, approval for the waiver does not provide continued eligibility for Medicaid. Eligibility for Medicaid needs to be redetermined annually unless the person is receiving SSI. There really needs to be a designated person taking responsibility to maintain Medicaid eligibility for a waiver participant. The responsible person is typically the individuals themselves, the parent, a guardian, or an authorized rep who has agreed to assume that responsibility. For the Medicaid waiver program, it provides needed disability-related services in the home and the community. It essentially waives the requirement for those services to be provided in a facility, such as a nursing facility or a group home. The developmental disability waivers are administered by the Division of Disability and Rehab Services through the Bureau of Developmental Disability Services. They are the family support and the community integration and habilitation waivers. The medical model waivers are administered by the Division of Aging. They're the aged and the disabled and the traumatic brain injury. A person must have active Medicaid in order to use waiver services. Medicaid and Medicaid waiver have separate eligibility criteria. Eligibility for one does not assume eligibility for the other. The Division of Family Resources is a state agency under the Family and Social Services Administration. I'll be referring to it as DFR throughout the presentation. It is responsible for establishing eligibility for Medicaid, as well as some other programs, including the Supplemental Nutrition Assistance Program, commonly referred to as SNAP or food stamps. DFR is responsible for processing Medicaid applications, as well as determining ongoing eligibility for Medicaid. Each person who receives Medicaid is assigned a Medicaid aid category. It's a designation of how a person is eligible for Medicaid. It's essentially the eligibility path. Each aid category has its own guidelines for eligibility. Some aid categories are based on household income and age of the applicant. Others include factors such as being a foster child or having a disability. It's important to know the aid category as it determines the eligibility requirements for continued benefits. The aid category is on notices from the Division of Family Resources, but it's not really obvious. If you receive an eligibility notice, there's usually a box around the main portion of the notice. And then in the top left corner, you'll see a couple of letters. It'll be MA, and then a number or a letter, and that is your aid category. Your waiver case manager has access to tell you what the aid category is if your Medicaid is active. Not all aid categories for Medicaid are compatible with the waiver. If you're receiving waiver services, it's pretty safe to assume that your Medicaid is in the right aid category, as long as there has been no lapse in coverage. The most common aid categories for a waiver participant are the aged, blind, disabled, employees with disabilities, who are working, and Medicaid for SSI recipients. There are other aid categories, primarily for minors and young adults, that are compatible with the waiver. However, the waiver really has no impact on their eligibility for Medicaid. So we're going to focus on the ones that are listed here, because they are the ones that do have some special requirements or rules that the waiver benefits. The majority of Medicaid recipients are enrolled with a managed care entity, such as MedWise, MHS, or Advantage. That means that the managed care entity is monitoring your use of Medicaid, encouraging you to seek preventative care to help keep costs down, and requiring you to see doctors within their network. Individuals on the waiver do not participate in managed care. Their Medicaid allows them to see any doctor who's enrolled with Indiana Medicaid. They typically don't need referrals to see specialists. When a Medicaid recipient is not enrolled with a managed care entity, they are considered to have traditional Medicaid. So if a doctor, therapist, or pharmacy ever asks what kind of Medicaid you have, you would want to reply that it is traditional Medicaid if you're on the waiver. And this is a different terminology than aid category. Traditional Medicaid is just telling the person that you are not part of the managed care system. If you were enrolled in the managed care prior to the waiver, you will be automatically disenrolled from managed care when you start the waiver. And then lastly, authorized reps. It's a designation made by the Division of Family Resources that allows another person or agency to advocate or represent the Medicaid member when communicating with DFR. It can be a family member, a provider, a friend. It really doesn't matter as long as the person would like for you to speak on their behalf. Due to privacy laws, the DFR caseworker can only communicate with the Medicaid recipient, the parent of a minor, or the legal guardian. The authorized rep form can be completed and submitted to DFR. It allows the caseworker to talk with a designated authorized rep regarding the status and specifics of the case. It also allows DFR to send copies of notices that are sent to the Medicaid recipient. If a person has a legal guardian, copies of the guardianship papers need to be submitted to DFR before the caseworker will be able to talk with the legal guardian. Now that we've reviewed some of the terminology related to Medicaid, I want to focus on the financial criteria related to Medicaid eligibility. Financial criteria falls into two categories, income and resources. Understanding the difference between income and resources and the eligibility criteria for both is a primary tool needed to maintain Medicaid eligibility. Income is the money that a person receives. It can be either earned or unearned income. Earned income would be things like wages from work. Unearned income includes Social Security benefits, child support, interest on savings accounts, benefits, and pensions. For Social Security and Medicaid, child support is considered the child's income and not the parent's. DFR will typically require proof of income, such as pay stubs or award letters, either at the initial eligibility or during the annual renewal process. If a person is approved for the waiver, a special waiver rule allows parental and spousal income not to be counted when determining eligibility for Medicaid for the aged, blind, or disabled categories. When the person is on the waiver, only the income of the waiver participant is collected and counted for those aid categories. However, you got to keep in mind that it only applies to the age, blind, and disabled categories. If a person is a minor on Hoosier Health-wise, and it's not one of those aid categories, the age, blind, or disabled, parental income is counted for minors. There's another special waiver rule related to income limits. For a person who is in the age, blind, or disabled category, the waiver participant can have monthly gross income up to $22.50 a month. That amount is always 3 times the current SSI amount, and for 2018, the SSI amount is $750. With the waiver, the income limit for the aged and disabled is significantly less. So if they didn't have the waiver, the maximum income they could have is $1,005 a month. But with the waiver, up to the $2,250 per month, up to $1,180 of that can come from earned income or work. The $1,180 is the current standard for substantial gainful activity, or SGA, that is set by Social Security. The SGA is a little higher for individuals who are blind. If total income is over $2,250 a month, a person can still qualify for Medicaid if they have a waiver, but a qualified income trust known as a Miller Trust is needed. The excess income over that $2,250 goes into the trust, and those funds are used to pay for Medicaid services in the amount that that person was over the $2,250. It's called a waiver liability. MedWorks is a Medicaid program for people with disabilities who are working. It follows many of the guidelines for Medicaid for the disabled. A person needs to be employed to qualify for MedWorks. A waiver participant is required to be on MedWorks rather than the Medicaid for the disabled if the income from work is over $1,180 per month gross. And like we talked about, that's at substantial gainful activity level. If they work and income from work and Social Security benefits total over $2,250 a month, which is that limit for the Medicaid for the disabled, they may elect to be on MedWorks rather than to go through the process of establishing a Miller Trust, which would have been needed for Medicaid for the disabled. There is a monthly premium that needs to be paid for MedWorks, and it's set on a sliding scale of the total income, and total income would include both earned, so pay stubs, as well as unearned, which would include Social Security benefits. Resource is defined as real or personal property that is owned solely or jointly by a Medicaid recipient. It includes things like cash on hand, checkings accounts, savings, bonds, stocks, and the cash surrender value of a life insurance policy if it is owned by the Medicaid recipient. The majority of Medicaid aid categories do not factor in resources. However, they are collected and counted for the ones that we're talking about today, the aged, blind, and disabled categories. The resource limit for a single person is $2,000, and it's $3,000 if they're married. This is the total of non-exempt resources in the person's name as of the first day of each month. The amount in the checking, savings, stocks, bonds, that kind of stuff, cash surrender value of a life insurance policy are all tallied up, and the total resources needs to be under $2,000 on the first day of each month in order to qualify for Medicaid. MedWorks is the aid category for people with disabilities who are employed. For MedWorks, there's a little exception to this. The funds in a retirement account are excluded from the $2,000 resource limit. So with MedWorks, money in a 401k or an IRA do need to be reported to DFR, but it is not counted towards the $2,000 resource limit. Some property owned by the Medicaid member does not count towards the $2,000 resource limit. These are considered exempt resources. The most common exempt resources include the home if the person is living in it, personal effects, household goods, one car, an irrevocable funeral trust, a special needs trust, a pool trust, or an ABLE account. Although they are not counted towards that $2,000 resource limit, the trust or ABLE documents do need to be given to DFR along with the account balances. So let's take a look at a few of these in more detail. Money can be set aside in an irrevocable funeral trust to pay for funeral-related expenses of the Medicaid member. The funeral trust can be used to cover such expenses as the services provided by the funeral home, staff such as clergy, the burial at the cemetery, as well as the reception following the funeral. Funds can be deposited all at once or over time. It does need to be irrevocable, and the funds cannot be used for anything except those funeral and burial related expenses. Any funds remaining in the account after all funeral related expenses are paid are subject to be used to pay Medicaid related expenditures, so you wouldn't want to put any more money in there than you would expect to actually need to cover those funeral costs. The value of the trust does not count towards the $2,000 resource limit for Medicaid. A funeral director can provide more information about establishing an irrevocable funeral trust. A special needs trust is another irrevocable tool that holds funds for the benefit of an individual with a disability. Funds in the trust do not count towards that $2,000 resource limit for either Medicaid or SSI. The trust is set up to ensure the care of the individual with a disability. It is often used for inheritances. Funds can be used to provide items and services to improve their quality of life that are not covered by available benefits such as Social Security. A trustee determines if the request to remove funds is appropriate under the terms laid out on the trust. The individual with a disability does not have direct access to the funds. A special needs trust can be established with the support of an attorney who is familiar with the Medicaid and SSI requirements for an exempt resource. There's two ways that a special needs trust can be funded. A first party or self-funded trust holds the assets that belong to the individual with a disability. These trusts must reimburse the state for its Medicaid costs upon the death of the individual. A third-party trust holds assets that came directly from another person, such as a parent, and this would be more of like an inheritance. These trusts are less likely to require reimbursement to the state for its Medicaid costs upon the death of the individual. A variation of the special needs trust is a pooled trust. A pooled trust pools the resources of many beneficiaries, and resources are managed by a nonprofit agency. Each individual has their own account. It can be set up as either a self-funded or a third party. If self-funded, the funds can remain with the nonprofit agency rather than going to pay for Medicaid-related expenses upon the individual's death. A new option is the ABLE account, which stands for Achieving a Better Life Experience. It's a 529 plan. Many of us know the 529 college savings plans. This is very similar. With the ABLE account, you're saving for disability-related expenses. In order to qualify, the disability does need to have occurred before the age of 26 and be as severe as defined by Social Security. Anyone can contribute to a person's ABLE account. Total contributions can be up to $15,000 per calendar year, and that amount does vary from year to year, but that is the amount for 2018. Funds in the account are not taken into consideration when determining eligibility for Medicaid or supplemental security income. However, for SSI, you do need to keep the total balance under $100,000 to be eligible for SSI. Funds in the account can be used to purchase qualified disability-related expenses, which is basically any expense related to the individual's disability that assists them in increasing and/or maintaining their health, independence, and/or quality of life. An ABLE account may provide more choice and control than a special needs trust. The account owner, which is the person with a disability, has the ability to control their own funds and make withdrawals as needed, although safeguards can be put into place. Funds can be withdrawn as easily as by using something like a debit card. There is a limit of only one ABLE account per person. Indiana's ABLE program is called Invest ABLE Indiana, and the website is shown. However, many states offer ABLE programs and welcome Indiana residents to participate. The fundamental feature of the ABLE account is defined by the federal government, but investment options and withdrawal options do vary from state to state. The DFR does not count the funds in the ABLE account towards the $2,000 resource limit, including those ABLE accounts that are established in other states. The ABLE National Resource Center is a very valuable resource. They offer really family-friendly webinars about ABLE accounts, which are later posted on their website. They also have details about each state's ABLE program to allow you to compare. Medicaid for the disabled is the primary Medicaid aid category that works with people who are between the ages of 19 and 64 and participating on one of the waivers. We just talked about the financial eligibility criteria. Since Medicaid for the disabled is so important to adult waiver participants, I would like to spend some time going over the disability criteria and the relationship with Social Security disability. There's a strong link between Medicaid for the disabled and Social Security disability. And Social Security disability is an umbrella term that includes SSI and SSDI, and I'll go into both of those. Medicaid for the disabled uses the same definition of disability and the same criteria as Social Security does for determining a person disabled. For minors under the age of 18, to be considered disabled, the person must have a physical or mental condition that results in marked and severe limitations. For adults to be considered disabled, the person must have a physical or mental condition that keeps them from working at a substantial level. The determination of disability for Medicaid and Social Security disability is different and separate from the criteria for the Medicaid waiver. If a person receives Social Security disability benefits, which would include the SSI and the SSDI, then they meet the disability criteria for Medicaid for the disabled. If Social Security has not made a determination, then the Division of Family Resources uses their Medicaid medical review team to determine if a person's disability meets the Social Security criterion for disability until Social Security makes a determination. So let's take a little closer look at SSI. SSI stands for Supplemental Security Income. It's a payment for low-income individuals who are either aged or disabled. And aged is defined as over 65 for both Medicaid and SSI purposes. The full amount of the SSI benefit for 2018 is $750 a month. A person may not get the full benefit if he's working or if he doesn't have many living expenses. Like Medicaid, SSI has a resource limit of $2,000 for a single person or $300 for a married couple. Household income is counted when determining financial eligibility for SSI until the applicant is 18. If a person receives SSI, the person is automatically eligible for Medicaid. The A category will be MASI to reflect that they are receiving SSI. SSI recipients do not need to complete annual recertification for Medicaid. They are automatically eligible for Medicaid even if they never applied. SSDI stands for Social Security Disability Insurance. It draws from a person's work history. If a person is determined to have a disability before the age of 22, they can draw off of a parent's work history if the parent is deceased, disabled, or retired. The amount of SSDI is based on the person's work history. If a person's SSDI is below a certain level, they can be eligible for both SSDI and SSI. They would get 2 separate checks. SSDI does not automatically make a person eligible for Medicaid. It does show GFR that the person has a disability, so that's really important. However, since the SSDI amount is often more than SSI, they need to verify that they meet the income and resource guidelines for Medicaid for the aged or disabled. As we discussed before, the income limit for Medicaid for the disabled for a waiver participant is $22.50 a month of total income, with up to $11.80 of that coming from work. If it's over that $11.80, then they would be placed on the MedWorks program, which is also compatible with the waiver. They also need to keep resources under that $2,000 resource limit. Unlike SSI recipients, SSDI recipients need to complete annual recertification for continued Medicaid benefits. If a person is determined not to be disabled by Social Security, it can have a direct impact on their ability to be eligible for Medicaid for the disabled, causing them to lose waiver services. Although it does apply to both SSI and SSDI, I'm going to focus on SSI today, as that is the most prominent benefit being applied for by waiver participants. If Social Security determines that a person is not disabled, then the GFR is required to also determine that the person is not disabled for Medicaid for the disabled, even if they were already receiving Medicaid for the disabled coverage, or if they have the waiver. For most individuals between the ages of 18 and 64, they need the Medicaid for the disabled in order to receive waiver services. Other than MedWorks, the other types of Medicaid available for adults with special circumstances, without special circumstances, really don't work with the waiver. The most common one is the Healthy Indiana plan. That is our Medicaid expansion, and that is not compatible with the waiver. This next step is critical. If you are determined not to be disabled by Social Security, that denial needs to be appealed through Social Security within 60 days of the denial notice for Medicaid for the disabled to remain active during the appeal. The SSA appeal needs to be shared with and processed by GFR for that Medicaid for the disabled to remain active during the appeal. And this is true for each level of the Social Security disability appeal. I just want to repeat, because this is just so important, and unfortunately it is affecting a few of our Medicaid waiver participants. So if a person applies for SSI and determined not to be disabled by Social Security, it's really important that they appeal that SSI denial through Social Security within 60 days of the notice, and that they give GFR a copy of that appeal. If you receive a notice from FSSA, Division of Family Resources, that the Medicaid is ending due to a negative decision regarding a disability decision by Social Security, you want to take a copy of that Social Security appeal to the local DFR office and ask to talk with a state caseworker or eligibility manager, because you want to make sure that it's processed correctly to keep the Medicaid for the disabled active during the appeal. Although you could submit the appeal some other way to GFR, it's really helpful to take the added step of actually going into the office and talking with the state caseworker and not just the people at the front desk, because you've got so much writing on this. We want to be able to keep that Medicaid for the disabled active during the Social Security appeal process. You will also want to consider appealing through Medicaid if you do get a notice that it's been denied. And that just helps make sure that the Medicaid office is doing everything they are doing correctly to follow the rules around a Social Security disability denial. When you're following up with the Social Security appeal, You would want to make sure that all available records have been submitted. You've told them about voc rehab and your waiver providers and medical professionals and anyone else who knows the status of the person with the disability. You can still submit records to Social Security as part of that appeal process as you're going through reconsideration. You may also want to consider consulting a disability attorney. The disability attorney will review the case and determine if they will accept the referral, as they are working only for a portion of the SSI back payment if they win. So there's typically no out-of-pocket expenses, but if they are successful in getting Social Security disability for the individual, they do get a portion of the SSI back payment. Next, I want to talk about the steps needed to maintain Medicaid eligibility. Medicaid eligibility is redetermined at least annually for everyone except SSI recipients. There is a recertification process that needs to be completed. In some cases, DFR does have enough information to automatically renew eligibility, but that's not the norm. I will go into more details about how to reestablish Medicaid following a loss, as well as share some tips about how to maintain Medicaid so that Medicaid just doesn't even lapse in the first place. Once Medicaid is established, it is redetermined at least annually. The recertification month typically stays the same from year to year. However, there are factors that cause it to be completed in a different month or more often than every year. As a team, you want to help assure that the waiver participant's Medicaid does not lapse. You want to make sure that the waiver participant is meeting the income and resource limits for their Medicaid. You also want to help assure that recertification paperwork is turned in to the DFR by the due date. The recertification form is called the Medicaid mailer. The household composition as well as some financial information will typically be pre-printed on the form. It's usually sent about 6 weeks before the recertification date. There's a cover letter that you want to pay attention to because it can be a little misleading for waiver participants who have the age, blind, or disabled aid categories. It may say that if there are no changes needed, that you don't have to return the form. However, for the age, blind, and disabled categories, as well as MedWorks, you do need to turn in proof of income and resources. So if you ever get the Medicaid mailer, it's in your best interest to go ahead and review it, mark any needed changes, sign and return it with those supporting documentation needed that's related to income and resources. When a person is on the waiver and has either the age, blind, or disabled categories, you only need to report the income and resources that are in the waiver participant's name. You don't need to report parental income or resources, nor those of other household members. But keep in mind, not everyone on the waiver has either the age, blind, or disabled aid categories. Parental income and household income does need to be reported for those minors on other types of Medicaid. You need to attach supporting documents such as pay stubs and bank statements for the waiver participant. You also want to assure that all requested information is received by DFR by the due date. Sometimes parental income and resources are pre-printed on the form. If the waiver participant has Medicaid for the disabled, that usually just suggests that they go ahead and fill out the information for the waiver participant, and then just make a note that the person has the waiver, just so that the person reviewing that form, it helps them make the connection between Medicaid for the disabled and the waiver, and it'll hopefully keep them from wondering why you didn't turn in parental information. There are times when Medicaid is automatically renewed without completing the Medicaid mailer. If a person's receiving SSI, then they're automatically eligible for Medicaid as long as they actively receive SSI. If a person has no other income other than those Social Security benefits, and the waiver participant has no resources in his name, then DFR may automatically determine the person eligible for Medicaid at renewal time. However, if you receive the Medicaid mailer, I would encourage you to complete it, sign it, and return it with those supporting documents. If the person on the waiver has no resources in his name, you'd want to write that in. It just may help the person get auto renewal the next year. Sometimes Medicaid will lapse at recertification. Medicaid typically lapses due to one of these reasons. The Medicaid mailer was not completed and returned to DFR, or it was turned in late and not processed. Maybe all of the documentation was thought to have been turned in, but it wasn't received, was not complete, was not exactly what was requested, or it was turned in late. The other reason is the person was over that $2,000 resource limit when bank statements and other resources were submitted. And sometimes a new resource is discovered, such as a life insurance policy, and the cash surrender value of that puts them over that $2,000 resource limit. Documentation is a vital process and a really, really important part of that annual renewal. DFR only confirms receipt of documents if it's hand-delivered to the office. A lot of times I hear people say that they faxed it in so they have a fax confirmation. A fax receipt does not count as proof of submission. DFR typically will not let you know if a document received was incomplete or unclear. It takes 2 or 3 days for documentation scanned into their system to be visible to the DFR caseworker. You always want to call DFR 2 or 3 days after documentation is submitted to assure that it was received and that it included everything that was needed. You'll want to ask the caseworker to review the document submitted to assure that it was everything that was requested, even if you hand-delivered those documents to the local office. The local office will scan the documents into their system, but the front desk staff typically do not review it to make sure that it was everything that had been requested by the caseworker. It's especially important to call DFR if the documentation is being submitted late. If it's turned in late, sometimes it won't even be accepted, but if it is, you want to make sure that somebody is actively processing it. If it's not tied to a due date, it seems to just kind of sit there and no one knows to go in and process it. So it's really important that you call and request that. There is a barcoded cover sheet that comes with mailings from the Division of Family Resources, and that helps make sure that the documents being submitted end up in the correct file. You want to make sure that you always have a cover sheet when you're turning in information to the DFR. If you don't have one, you want to make sure that the person's full name, social security number, case number if you have it, and date of birth is on that documentation you're submitting, because someone has to go in and manually bring that information into the person's file. You want to make sure that you maintain Medicaid eligibility once it's established. In addition to making sure that you've turned in that Medicaid mailer for recertification, as well as those supporting documents tied to income and resources, you want to make sure that you're reporting changes to DFR. That 1-800 number I've got listed works for the whole state. You can also go into your local DFR office. There's at least one per county. You want to make sure you report a change of address so that you get the Medicaid mailer the next year, as well as other DFR notices. Reporting a change of phone number is important as well. You want to report changes to finances, including a new job, loss of a job, or change in resources. If Social Security benefits are changed from SSI to SSDI, so with SSI, they're automatically approved. SSDI, Medicaid benefits, are not automatically approved. you need to contact the Division of Family Resources because they'll need to do an aid category change for that person to continue to receive Medicaid. You also want to make sure that the authorized representative remains current. Perhaps you change providers and the provider used to be your authorized rep and now you're no longer associated with them. You want your new provider to be an authorized rep so that they can continue to support you with maintaining Medicaid. So sometimes Medicaid will lapse despite our best efforts. So I'd like to go into more detail about what to do if Medicaid does lapse. If you're the person responsible for maintaining Medicaid, you need to know why it lapsed. You'd want to call or go by the Division of Family Resources and talk with the caseworker to determine why it lapsed. Once you determine why it lapsed, you need to ask the caseworker exactly what is needed to reestablish Medicaid. The actions needed usually fall into one of two categories. Either specific documentation needs to be submitted or a new Medicaid application needs to be filed. If the caseworker responds that specific documentation is needed, then you will need to gather documentation and submit it to DFR. Use that cover sheet to assure that the documentation ends up in the correct file. If I don't have the cover sheet, then I go down to DFR and they print one off for me and they scan it right into their system. Then you'd want to follow up with DFR 2 or 3 days later to make sure that the documentation you submitted was everything that was needed. So you'd call or you'd visit and you'd want to verify that, did they get the documentation? Is it in the file? Have them open it up to make sure that what you turned in matched what was needed, and that if it does have everything, that they're going to forward the file to the state for final review. You'll want to continue to call DFR and talk with the caseworker at least weekly to check the status until a new Medicaid eligibility is received. When you talk with the caseworker, ask them questions. You ask them questions to help assure that the file has been sent to the state and that it's pending state review. You want to make sure that no other documentation is needed. Did the state review that and determine that the bank statement wasn't exactly what they needed? Is there something else that's needed to make sure that the Medicaid comes through? If the initial response from the caseworker was that a new Medicaid application is needed, rather than simply submitting missing documentation, you will need to submit a new Medicaid application. This can be done online, at the local DFR office, requesting a paper application, or you can actually call and someone will help you do it over the phone if you call that 1-800 number. Once the application is completed, the interview can be completed either by person at the local office or over the phone. If you do not know the day and time of the interview within a week of the application being submitted, you'd want to call DFR to make sure that they got your application and to go ahead and schedule that interview. During the interview, the caseworker will ask questions about the person's income and resources. If the person does not receive Social Security disability, it may also include some questions about the person's disability. Once the interview is completed, DFR will send a pending verification list of specific documents that need to be submitted. These requested documents need to be received by DFR by the assigned due date, which is typically 13 days after the interview date. If requested documents are not received by the due date, typically the Medicaid application will be denied. Unlike submitting information with that Medicaid mailer, brand new Medicaid applications, there really isn't a leniency on that due date. If you're not able to get the requested documentation, then you need to call DFR to explain the difficulty and determine if there's another way of getting it, or would they accept some other type of verification. You never want to simply not turn in something that was requested. If they're asking you for a bank statement for an account that does not exist, You likely need to get a letter from the bank verifying that. Once documentation has been submitted, you're going to follow that same procedure that we just talked about in terms of making sure that DFR received the documentation and that it was everything that was needed. If you're aware of the Medicaid loss but not directly responsible, there are some things you can do to provide support for reestablishing the Medicaid. The first thing is to make sure that they are aware of the Medicaid lapse. You would want to encourage them to contact DFR to determine why it lapsed and what actions are needed to reestablish. You would also want to stay in contact with them to assure that continued progress is made. You can encourage them to follow up with DFR as needed. You can also make sure that they understand the steps involved. You can assist with obtaining needed documentation, such as bank statements or pay stubs, and explain what to expect once the new application is filed, such as the interview and the documentation timeframes. You can also offer to be an authorized rep to be able to talk directly with DFR about the case and obtain copies of notices. You may run into some stumbling points in the process, and these are some of the most common ones that I see. You may contact DFR and the caseworker won't be authorized to talk with you. In that case, you need to submit an authorized rep form or a copy of your guardianship papers. A new authorized rep form needs to be submitted anytime a new Medicaid application is submitted. In the meantime, you could complete a three-way call with the person or accompany them to the local DFR office to help them ask those questions. Also, I often hear from people that they have a hard time reaching DFR. They are open Monday through Friday, 8 to 4:30. You really can't reach them outside of those time frames. There is one phone number for the whole state. It can be a bit of a maze navigating those touch-tone options. So I usually recommend that when you're first prompted, enter a 1, and then at the next prompt, enter a 9. It will then ask you for your zip code. If you enter that, and it'll repeat your zip code, and you enter a 1 to confirm that, you will be directed to a live person. The other thing I hear a lot is that they've done everything that's needed and they're just waiting to hear back. You don't want to assume that the application or submitted documentation is being processed. Typically, no news is not good news. You want to call at DFR every 7 to 10 days until that Medicaid issue is resolved. One of the more tricky stumbling points is when DFR tells the person that their Medicaid is active. They call, they ask, and the caseworker says, yep, the Medicaid's in place. When that happens, a lot of times DFR is not looking at the traditional Medicaid or that full health insurance. There's a type of Medicaid called Qualified Medicare Beneficiary, or QMB. QMB pays the Medicare Part B premiums, but it is not a comprehensive health insurance. If you're told that Medicaid is active, then you need to ask a follow-up question. Ask them, are you looking at the full Medicaid or the traditional Medicaid? Or specifically ask, are you looking at the Medicaid for the disabled? Because my provider's telling me that my Medicaid isn't active. A lot of times the person was looking at the QMB. If the caseworker was looking at the Medicaid for the disabled or the full coverage, then ask them why would my provider not be able to see it at this point? Ask them for the effective date. Maybe it's set for a future month in error when it really should have been set for the current month. Then the last stumbling point I wanted to review was exceeding that $2,000 resource limit. DFR looks at the total of non-exempt resources as of the first day of the month. If bank statements or other documentation submitted shows that the balance is under $2,000, then a Medicaid application is typically required. The application is denied as soon as it hits that $2,000 during recertification, so a new Medicaid application is needed. You want to assure that the totals of all accounts are under $2,000 by the first day of the next month, and then just go ahead and file a new application. If large amounts of money are spent, then you want to keep receipts of that to explain what those transactions were. Then I'd like to finish up by reviewing some resources that are available to you related to Medicaid. The DFR portal is located at fssabenefits.in.gov. Although there are other websites with links to it, this is the most direct. This is where you go to apply for Medicaid. You can also create an account as an authorized rep and check the status. You can print the barcoded cover sheet from here, check the interview date, look at non-specific list of pending verification, and a non-specific list of documents that have been received. This link is to the Indiana Medicaid main website. It's a resource for Medicaid providers as well as Medicaid recipients. It has some of the best family-friendly language I've seen. There's a resource center. It'll go into more information about coverage and things like that. There are links to apply for Medicaid and to search for a provider. It gives access to the Medicaid health insurance manual, and that's the manual for what Medicaid covers as a health insurance for things like home health aid, equipment, and supplies. To get to the manuals, you just need to enter as a provider, and it's simply a button. It's not asking for any credentials. This website is the direct link to the Medicaid Program Policy Manual on the indiana.gov website. This policy manual is how eligibility is determined for Medicaid. It explains the eligibility criteria for each aid category. There's a chapter that focuses on the waiver and goes into details about those special waiver rules I talked about. It defines income and resources and goes into all of those details. And lastly, I wanted to share some handy phone numbers. There are many agencies that are related to Medicaid, whether it's to determine eligibility, such as DFR, or just using Medicaid as a health insurance. We focus mainly today on DFR, which determines eligibility. That phone number we talked about before, it works for the whole state. The next number is Medicaid Member Services. You would contact them to ask specific questions about Medicaid coverage, such as how often can I see the dentist? Optum Rx manages the pharmacy services for traditional Medicaid. You would want to contact them if you have questions about why a particular medication is not covered. And then CMCS oversees the prior approval process for traditional Medicaid. Some Medicaid-funded services, such as durable medical equipment or home health, does need prior approval, and that is the agency that oversees that. MedWorks, as we talked about, is for people who are disabled and working. There may be a premium payment associated with it. You can contact MedWorks to pay your premium over the phone or to just check the status of a premium payment. Provider Relations oversees Medicaid claims and assists with billing issues. This number would be used mainly for providers. And lastly, the Family Helpline. There are staff that can assist with issues related to Medicaid. They're a really good resource if you're having trouble finding a Medicaid accepting doctor or other provider. So that concludes the presentation. You can enter questions in the chat box. And I think, Lana, do we have any, or do we have time to review a few?
Well, I think, thank you, Diane, first of all, that once again was excellent information that I'm sure is going to be very useful for all of our attendees. We do have a few minutes for some questions. I will say that I am going to ask more of the general questions that were submitted. If you have a specific concern related to a specific individual, I would suggest that if you are associated with IPMG, either as a case manager or we provide support to you, that you reach out to Diane directly for those more specific situations. So the first question that I have is, if a person has never used their Medicaid and they're unsure if it's still active. How would you find out if it is still active?
If you are receiving waiver services, your Medicaid is actually being used because it's helping to pay for those waiver services. If you are looking to get waiver services, then the BEADS office will work with you to make sure that your Medicaid is active. If you're receiving waiver services, you can always reach out to your case manager because we have the ability to check Medicaid eligibility. If all else fails, just contact the Division of Family Resources. They'll look you up and be able to tell you that.
Thank you. The next question asks about individuals that have the waiver but still have Anthem managed care, and how would you advise them to have this changed to traditional Medicaid?
The process happens automatically. As soon as that waiver budget goes into the system, that tells the managed care entity to disenroll that person from a managed care program. Unfortunately, I'm not aware of any state notices that go out, and we do run into problems where the person doesn't realize that they've been disenrolled. So you may not get a new Medicaid card. Your Medicaid card may still show Anthem, but if you're actively on the waiver, when you go to the pharmacy, when you go to the doctor's office, tell them that they now have traditional Medicaid, and that should be enough for that pharmacy or doctor to find them in the traditional Medicaid system. Now that there's so many managed care programs out there and the majority of people are on managed care, a lot of time the pharmacy or the provider will just assume that the person is on the managed care and not look in the right system. So just tell them that you've got traditional Medicaid now, and you can contact the Division of Family Resources to request an updated card.
Okay, thank you. The next question asks, how is income from a SNT counted?
I'm going to need to look that up.
Okay, that is fine. Also, just to let everyone know that we obviously may not be able to get through all of the questions this afternoon. I will provide them to Diane, and she will be able to provide some responses again to those more general type of questions, and we will post that in the Q&A section on our website. It will also be included that the email that you will receive within a couple of days. It will not be included in your attendance email, but it will be included in the one that we generate that includes the links to the recording for today, as well as the materials. So if we're not able to get through those, or there are questions Diane needs to research a bit, then we will be able to provide those to you within a couple of days through our website. Another question is asking what the resource limits are for the aged and disabled waiver recipients.
Resources are a little different if a person is married. The resources that I talked about today applies to the med model waivers. There really aren't any differences between the DD waivers and the med model waivers. So they've got that $2,000 resource limit. It gets a little bit more complicated because many of the people on the aged and disabled waiver are married, and there is a spousal impoverishment protection when a person is first applying for Medicaid that can be used. And it basically allows a certain amount of resources that's jointly owned by the married couple to remain with the spouse that's not on the waiver, so that they don't have to be within that $2,000 or $3,000 resource limit for a married couple. Most of that takes place when you're first applying for Medicaid.
Thank you. The next question asks if the waiver limit has changed for 2018 from $2,205 to $2,250, or was that a type incorrection? It was incorrect on the slide.
It's always 3 times the SSI amount. So SSI is $750, so 3 times of that for this year is $2,250 a month.
All right, thank you. The next question asks if those on MedWorks are eligible for an ABLE account.
Yes.
Great. I think you answered this one, but I'm going to go ahead and ask, if an individual has over the $2,000 in their resources on the first of the month, how long do they have to spend down that amount before they risk losing benefits?
It pretty much depends on when their recertification is coming due. Once you turn in the Medicaid mailer and the bank statements, if those bank statements show that the person is over $2,000, that will cause them to have a lapse in their Medicaid the next full month typically. So it's just kind of the luck of the draw when those bank statements are going to be requested.
I think we have time for a couple of more. Again, like I said, I will send the questions to Diane, and she can go through them and answer them so that we can include that in the Q&A section. The next question asks if the funeral trust can actually pay for the cemetery plot.
Yes, it can. Any of those kind of funeral-related expenses, definitely.
This is another question related to the ABLE account. If the person could an ABLE account allow a person with a disability to be able to private pay for help managing their finances or for grocery shopping?
Yes, I believe all of that would count as a disability-related expense. It's a really broad definition that the IRS has set up.
This is a fairly general question, and I'm not sure, I think it probably would be specific to the person, but they're asking what would cause SSI to determine that someone is not disabled?
It typically is related to work. If a person is first applying for SSI, if they graduated with a high school diploma, that tends to show Social Security that they were able to graduate from high school and enter the workforce just like anyone else. If a person is working, and even if they're working part-time, they would need to be able to show Social Security that there's reasons why they can't work full-time. Once a person is an adult, the whole focus is on, can that person work, and are there barriers that are really preventing them from being able to do that?
Thank you. And we have time for one final question. So the question is, how does the Medicaid office receive the CCD, or cost comparison budget, for individuals that receive the waiver in order for the category change to occur?
It's all done electronically. As long as we have an active budget in the system, that information is electronically shared with the Division of Family Resources. Once in a while, you run into a case where they can't see it and they need to update their system in order to see it. But really, needing to turn in those NOAs or CCBs typically isn't needed anymore.
All right, thank you very much, Diane. Thank you all for attending. As I mentioned at the beginning, once we end today's session, a survey will appear. We would like for you to take a few minutes to fill that out. And we look forward to having you all back with us on February the 16th, and the registration information for that workshop will be available soon. Thank you, everyone, and have a great day.